Hey, welcome everybody. It is Health Talk. We have a half an hour every Monday where we visit with folks from Community Medical Center talking about various health issues. John King right over there. Good morning, Mr. King, sir.
Hey, good morning, Peter.
Or shall I call you Dr. King today?
I feel like I don't deserve the title.
Better. Well, you'll be married to Nurse King here pretty quick. So
I will. She's already a nurse practitioner King.
There you go. Okay. Yes. But we have Brenda Toner joining us this morning, an occupational therapist with Community Medical Center. So welcome to the show.
Thank you for having me. I'm honored to be here.
Now, you came to talk about a pretty serious subject, and that's brain injury, right?
Right.
So if you wouldn't mind just telling us a little bit about the Brain Injury Alliance,
sure, and
what you help folks with. And brain injury is pretty self-explanatory, but there's a whole range of things in those two words, right?
Right. Well, Community Medical Center partners with the Brain Injury Alliance of Montana to help promote awareness, and we participate in a lot of prevention and advocacy efforts. And I think one of the things that I wanted to talk about today was an event called Bowl for Brain Strong, and it's a fundraiser that benefits Montanans no matter where they live, be able to access resources and participate in things like support groups, or the Brain Injury Alliance provides a 24-hour phone-based helpline, and that links people with resources in their areas. And I think one of the things that we try and promote is that brain injury isn't just about traumatic injuries like result from car accidents. It could also be an acquired brain injury that you would get from like a stroke, for example.
So why is there an alliance? Like there's not a you cut yourself with scissors alliance, other types of injuries don't have an alliance.
Yeah.
But brain injury does. So tell us a little bit about that aspect of it.
Sure. There's a national group, the American Alliance of Brain Injury Organizations. And so that is, we're a chapter within a larger national organization.
And so do you share information, or what do you guys do when you are cooperating?
Right. Well, the national group provides much more robust educational materials and website assistance. And then the Montana Brain Injury Alliance works with providers and community members throughout the state to reach out to families and individuals impacted by brain injury. And they have over 200 people that are actively involved in support groups throughout the state. So they put on a conference each year. This year it's going to be in Bozeman, and they try and rotate it so that it's much more accessible.
All right. Now, I want to talk a little bit about brain injury.
Sure.
I've been doing a lot of reading about, like enhancing your brain and thinking in certain ways and trying to adjust, stuff in there so it works better.
Right.
But in a brain injury, I think a lot of people don't really understand how impactful that is. I have a dear friend who just recently suffered some sort of, it was a seizure or whatever, and when all was said and done, feels fine, walks good, everything's great. When it comes time to talk, the words don't quite get from here to here properly and in the right order, and it's just driving her crazy because she's thinking the words. She knows exactly what she wants to say, but her mouth just won't do it.
Right.
And so she has to speak very slowly and very deliberately, and she's a professional woman, so it's really affecting her.
Right.
And so to talk about this a little bit, because a lot of people may have a brain injury and not know it.
Right. And I think one of the things that people who have had a brain injury voice a lot of frustration about is if they don't have outward physical signs that they've had an injury, oftentimes people don't recognize that some of the symptoms they might be experiencing, like your friend, with word finding problems, those are things that in rehabilitation we would address. So speech therapy or speech pathology services are really kind of the lead rehab discipline to address things like that.
Now, is that the main way that brain injury will express itself through speech, or are there other ways?
Yeah, there are other ways. Our brain is so
it controls
everything. So it's so complex, and and each brain injury really is unique. So some folks will have much more physical outward signs, whether it's loss of balance or muscle tone is disrupted or coordination. Others will have more cognitive signs where they know exactly what they need to do, but they can't initiate doing those types of tasks.
It's terribly frustrating.
So, yeah. So it really impacts everything from daily living skills to language.
So as a brain injury specialist,
Yes.
in a field that's so diverse and intricate, like, what do you do? Do you just kind of try to find the problem? Are you like, do you do diagnostics, or do you do help recovery, or both?
Yeah, all of the above. We evaluate people. So, for example, physical therapy is going to be much more interested in how their mobility impacts their function. And occupational therapy is very interested in how they're able to carry out their self-care and normal routines throughout the day. And then speech pathology is interested in how are they going to go about problem solving and paying attention and being able to communicate. So what we do in therapies is evaluate those skills and then come up with a plan to either try and compensate for those difficulties or through, say, technology, or we'll try and have them practice skills.
Can those brain injuries get better? I mean, can because the one thing that would just make you terribly frustrated, forever is, you mean I'm going to be like this forever? Right. Are there ways to reconnect? Because there are quite literally millions of synapses or whatever they call the connectors in there that may have gotten jostled or mixed up or whatever. Is it possible to put Humpty Dumpty back together again?
Yes. That is the basis of rehabilitation, is that the brain is double wired. So what we are trying to do is challenge people to be able to perform those skills again. And it may need.
What do you mean by double wired?
Meaning that there are other parts of the brain that might be able to assist.
To compensate.
To compensate. So we really try and set the stage for people practicing those skills in a way that, is successful, but it challenges them.
It's redundant, Peter.
Yeah, redundant.
Thank you.
Thank you.
See,
the word finding problems.
There you go. See?
Yes, have.
It's kind of like, if you will, Engineer Montgomery Scott on the Starship Enterprise. So they have to bypass the dilithium crystals in order to get the life supports, get the phasers working again. I'm sorry,
Peter. That's the example I was going to use, but since you stole it,
it's a dilithium crystal. Yeah, that's exactly right.
That rolls off the tongue.
Captain, I got no power, Captain. Anyway,
so I'm curious though, how do people usually injure themselves or get injured? What is the cause that brings people to you?
Yeah, probably in Montana, probably the leading cause currently is a motor vehicle crash. But one of the things I think that people are not as aware of is that falls is generally always in the top 3 in terms of reasons for resulting from brain injury. And so a lot of our patients are possibly in the older generation and with lower vision and difficulty with balance. Just a simple fall going to the mailbox can really set people back.
We're up against our first break, and we have a caller, so we're going to give you some headphones, and you can listen to Mark when he comes back on. Mark, we lost him. Anyway, 721-1290 is our number, 1-800-568-5309.
He had a question about muscle memory.
Yeah.
Maybe he'll call back.
So we're going to come right back and talk more with Brenda Toner from Community Medical Center. We'll be right back. There you go. Going to get rickrolled here, Arts. 721-1290 is our number. It won't stop. I'm sorry.
Oh.
Okay, that's John King over there. I'm Peter Christian, joining us in studio, Brenda Toner. And let's get Mark on the line. He's been waiting very patiently. Mark, good morning. You're on with Brenda. Go ahead.
Brenda, I'm a big sports fanatic. I mean, watching, not actually doing. And they always talk about using their muscle memory to help them improve in sports. So if you have a brain injury, do you lose what you've been doing for years and years? I'll listen off the air.
That's a really good question.
That is a very good question. Mark, if there isn't a disruption in the ability for the brain to send messages to those muscles, then, yeah, you would probably preserve a lot of muscle memory. But if there is a disruption, whether either it's from cell death or those cells are interrupted, then that kind of negates the ability for the muscle memory to remain in terms of that movement. But the unaffected side would certainly still preserve muscle memory, I would assume.
So we were talking earlier about how it's a redundant system, or a dilithium crystal system.
Yes.
However Peter wants to envision it.
Thank you very much. I'm here all week.
As a parent, you see your kids running into objects for the first 8 years of their life, and you wonder how we ever get out of childhood without brain injury.
Absolutely.
And I've heard, of people born without parts of their brain that the brain will grow into. I heard that Einstein had this issue as well, and that certain parts of your brain, when they're trained to work in other ways, you might end up seeing the world in quite a bit different way.
Right.
Is this something you've kind of seen? And is it easier for children to recover from brain injury than adults?
Children definitely. I think the science supports more neuroplasticity, so the ability to really recover from incidences like, bumping their head and that sort of thing. But I think we certainly want to promote prevention first. We don't want to challenge that neuroplasticity belief. But, people are hopefully finding ways to prevent any injuries from.
So when you go to Rocky movies,
right,
and you see him getting wailed on by all these big guys and getting just basically the snot kicked out of him, a couple times, whatever. As a brain injury specialist, are you thinking you are setting yourself up, pal, because that brain just gets knocked around in there and it gets damaged, right?
Right. Yeah. Absolutely. There are some sporting events that are difficult to watch for sure.
Right.
And boxing is one of those.
We've heard of people at peak physical fitness, i.e. Batman, right? Batman can keep getting hit and hurt, and he keeps rolling, right? But when it comes to the brain, that's not a muscle that's like easy to train. Are there people that have higher cognitive function that recover better from brain injury? Or is it something you can even try to prepare for?
I think one of the things that we see with especially adult patients is that those with various life experiences that they can draw from really do very well in terms of being able to apply some of the things that they used.
I think every single person that heard you wrote, yes, I've had various life experiences. What do you mean?
For example, if a person has been actively working and engaged in learning by different methods. So people that not necessarily have gone to school, but have maybe had lots of experiences that they could then apply. So if they suffered a stroke and only had use of one arm, one of my most memorable patients was a rancher. And that man, because he was so used to having to do things with, while holding wrenches and gloves and animals with one arm, he could, do all these things with his unaffected side. And that really translated well for him in terms of recovery because he was so creative with coming up with ways to solve problems.
So when I was a child, I would pick things up with my feet. And my dad did not like this. When you drop your fork, don't pick it up with your toes, John. But I was just preparing.
Right, you were.
Yeah, that's exactly. Right. I'm having various life experiences right here today.
When we had, a couple of years ago, we had a couple of fellows in here doing research for a brain injury. And they were talking about helmets, okay, and talking about football. And I asked the question, okay, can you come up, is there a helmet that will actually protect young people from brain injury playing football? And he says there's really no such thing.
Right.
Because the brain, especially going back and not necessarily up and down, but back and forth, that banging against the skull either way.
Right.
When you get hit by a 300-pound lineman, going the opposite direction, boom, and you don't see it coming, that's going to injure you, right?
Right. Yeah, it's that forceful blow with the brain moving inside the skull. We call it a contre-coup injury, where the force creates the brain to move forward, and then it rebounds back and hits the back part of the skull.
And then the movie Concussion with Will Smith, which I thought was brilliant.
It was
brilliantly
a great
done.
movie.
It just like, whoa. I mean, it opened my eyes to a lot of different things. And finally, the NFL is beginning to move along on that.
Right. I do think, that one of the silver linings of all of the information out there as a result of the NFL hopefully will impact sporting, down into the, Pop Warner leagues and that sort of thing. And I do think people are certainly restructuring the way they practice and that sort of thing so that athletes are taking less hits.
That's at least 3 movie references so far.
Thank you.
This might be a record.
Yeah. But I haven't hit Alien yet, though.
Oh, no. I was wondering, when it comes to sports injuries, how that's what we hear about, as the general public. How regular is that? And what types of sports do you see the most injuries from?
Actually, surprisingly, cheerleading is one of the higher frequency.
Because they get dropped on their head?
Because they get dropped on their head,
right.
yeah. But, the obvious ones of football and
soccer,
lacrosse.
A lot of heading out there.
Yep,
right?
A lot of heading. I know there's movement afoot to try and get the ability to head taken out of the game. I think that might take a while to, for people to adopt that. But, a lot of those types of sporting events, you see a lot of pretty violent collisions in lacrosse.
And now softball pitchers, I see more and more of them wearing that protective helmet with the face guard on it in case you get a comeback. We call it a comebacker.
Right.
All of us who've ever pitched have had a comebacker, and some of us are getting out of the way, and some of us aren't.
Right.
So
they have come up with a lot more, aesthetically pleasing helmets and ways to prevent injury. So. It's really nice to see athletes adopting that.
We're going to take a break, come right back, talk more about the special event coming up, because we're going to bowl for this. And not a whole lot of ways to injure your head while bowling.
That's right.
Unless you've ever watched me. So
I was going to say, have you ever accidentally stepped onto the slick part of the
Right. Yeah, that's true.
We'll be right back. And we are back on Talkback. I'm sorry, Health Talk. Talkback's coming up. All right. Joining us in studio, Brenda Toner, occupational therapist, certified brain injury specialist at the Rehabilitation, easy for me to say, Institute of Montana. And so now let's talk more about this event. Go ahead, John. You had something else you want to
Well, that's okay. Let's talk about the event first because we're getting close to the end.
Yes.
Sure. The Brain Injury Alliance and community are really pleased to bring the 4th annual Bowl for Brain Strong event. And it's going to be held on April 30th at Westside Lanes from 11 to 3. And they have a 50-50 raffle. They've got a silent auction. They'll be serving lunch. And we're really just trying to fill up the lanes. And if people are interested in bowling, one lane is...
Yeah, go ahead. How much is it?
Yeah, it's $250 for up to 6 team members. And for those of you really good bowlers, if you get a perfect score, you could win $1,000.
A perfect game.
A perfect game.
Yeah.
So there will be no competition from me
it's
for that.
It's probably as easy for me as the perfect bracket was.
Tell you what, you go to Paradise Falls and talk with the owner there.
Okay.
He has rolled a couple of perfect games.
Really?
So recruit him.
I would love to recruit
to get him on the team.
Yes.
You might want to pay him $250
Right. Yeah, exactly.
to be on your team. Curious, the question I had was, do you have like really cool machines? I mean, do you have some really interesting gear?
In brain injury rehab?
Yeah.
Well, you know what? Some of the most effective tools are low-tech tools, but we do have
the
some
brain and
assistive
jar thing
technology.
that I'm imagining from
Right.
old sci-fi movies? Or
Yeah,
what?
we have lots of brain models, and we do a lot of education with people to understand, what lobes of the brain have been impacted and what they control, so that they understand, some of the symptoms that they're experiencing. So
We have 1 minute left in the show.
All
So
right.
real quick, what is the best way for moms and dads out there to protect their kiddos and keep them from getting their brains injured?
definitely wear helmets when it's a sport that would allow that. And really just to be role models for kiddos. We see a lot of folks out biking now as the weather warms up, and I love seeing that the kiddos have helmets on, but the adults need to have helmets on as well so that they know that's
Well, yeah, especially if you're sitting
The
next
best
to some really concerned parents that are watching a sporting event. You might want to bring
Right.
And now I'm concerned because I have a young daughter, right? Yeah, you
Yeah.
look beautiful, honey, but you'd
Right.
be a more beautiful cheerleader with this helmet on.
Yes. Or
right.
maybe go out for golf or
Yeah,
something.
How about some contact information for your group?
Sure. The contact information for folks at the Brain Injury Alliance locally is 241-6442, or if you're out of the area, it's 406-541-6442.
Brenda, thanks for being with us.
Thank you for
Appreciate
having
it.
me. This was fun.
You're welcome back anytime.
Thank you.
All right, that's going to do it for Health Talk. Rob Nadelson will be joining us at the top of the hour from the Independence Institute in Denver, Colorado. We're coming right back.